this is part two of the interview with Neil Woods from the LEAP UK organisation. That stands for Law Enforcement Action Partnership, which started out as Law Enforcement Against Prohibition, which, as that title suggests, is people who've worked in law enforcement who are now reconsidering their approach to drug policy and actually advocating for drug policy reform. So in this next part, we talk about LEAP and we talk about prohibition, we talk about drug policy, and Neil's perspective on it. It's an amazing second part. Again, there's parts 3 and 4 which are also amazing, but these stand alone. So if this is the only one you watch, fine, but just please like LEAP, please look into LEAP, please support the channel. And please support the the movement towards drug policy reform. Very much up for debate. I mean, is your view on drug policy and policing completely changed? I mean, what would your kind of 5-point plan be to try and at least make a start to try and improve some of this stuff?
Well, the first thing is end the war on drugs. There are many steps in drug policy that we can do to save lives, reduce harm, and make society safer. It's logical, of course, to decriminalise possession of drugs because nobody should be persecuted for what they do with their own mind and body. I understand that now. I didn't care much for individual liberty as a young cop. I thought that security was far more important than individual freedom of choice. But now, of course, I understand that it's restricting people's individual liberty, which has led us to this security nightmare. So it's sensible, like Portugal has done, to decriminalise drugs. But I come at this from a policing perspective, as I represent my organisation that I'm a member of, the Law Enforcement Action Partnership. We come at it from a policing perspective, and so our position is that doesn't go anywhere near far enough. Is that all of the drug markets need to be regulated. They need to be run by the state, like alcohol is regulated, like tobacco is regulated, and so is caffeine. And sugar, for that matter, poorly regulated. And so to me, it's about taking control, because things are out of control now. We didn't have a heroin problem in the UK until it was prohibited. When we had the British system, up until the end of the 1960s, if somebody had a problem with heroin, it was prescribed to them by a doctor. And as a result of that very pragmatic medical control of heroin, we did not have a heroin problem. So at times when the United States, which they prohibited their heroin in 1914, at times through the 1920s, 30s, 40s and 50s, they had hundreds of thousands of problematic heroin users. In the UK, we measured ours in hundreds. And, you can see a very clear cause and effect there, that prohibition caused the problem. So because of the point that we ended the British system, there was 1,046 heroin users in the UK, and the number was falling. 20 years later, that had gone up to 300,000. Now, that's a very dramatic piece of epidemiology with a very clear genesis point, a very clear epicenter. So we regulate, and we regulate according to the requirements of each individual commodity, because drugs are not just drugs; they're all manner of different things. Heroin is the easiest one to regulate because we go back to the British system, and I mean that's beginning already. In Cleveland, policing money is being used to prescribe heroin to the most problematic users in Middlesbrough by use of a very clinical heroin-assisted treatment program. Now, it's my position that this modern, very strict clinical heroin-assisted treatment model is far too strict, and we need to be more liberal, and it needs to be more widespread, and it needs to encompass much more larger numbers of people. On the other end of the spectrum, of course, we'd probably start with cannabis. I would go along the lines of the Canadian model of regulation, but I'd suggest we do it a lot better by taking much more care to ensure good quality and make sure that the regulated product is of a finer quality than, or is at least as good a quality as is available from some parts of the illicit market, but also it needs to undercut the illicit market, not be double the price like it is in Canada, because it sort of defeats the point. Like David Lammy at the Labour Party conference last year, because I spoke at an event there, he made the point that when we do regulate cannabis in the UK, the Treasury needs to stay completely away from it, because this is not a money-making exercise, and to bring it into the care of public health, not the criminal justice system. And then, of course, you've got all of the drugs in between. I mean, more your specialism than mine, but the psychedelics, the idea that psychedelics are banned because of the harm they cause is utterly ludicrous. The evidence is so clear that they are on balance of more benefit than harm. I don't think that's an unreasonable thing to say.
Yeah.
And of course, MDMA is a very important one, because it's the drug that fills the newspaper columns. It's the drug that almost every death is reported on, but it's not banned because it's dangerous. It's dangerous because it's banned. It's because it's unregulated.
Brilliant points there. Yeah, I mean, I was talking to someone out in California about the way that the kind of legalization was handled out there, and that people the original growers were essentially put out of business because these sort of state regulations that were put on them, these sort of massive increase in their costs, massively uncompetitive product then, because they couldn't compete with the bigger farms. And so now you've got this kind of really crazy situation that the regulated market's so expensive that people actually, there's a massive boost for the black market, and a lot of the regulated market stuff is sold elsewhere. And it's just that it's been a bit of a shit show, to use a technical term for it. Just a point you made earlier about being sort of a young man, 19, I think you said you were, maybe going into the police and then being thrust into these very, very difficult, emotionally charged and very complex environments. Something that's really occurred to me over the last few years as I've been working more with so shaman in Peru and kind of elders with kind of wisdom and knowledge. And I look at, say, a lot of politicians these days as well. They seem to be quite young, quite young and inexperienced in life. Do you feel there's a sort of it seems to be a sort of process that you see is like that, the more experienced and more knowledgeable you are in somewhere like, the police or in business or whatever, they want you out the door. I mean, they don't want experienced, wise heads. They want, because they're expensive and potentially, or they don't just sort of roll over to the kind of to the group think or whatever. In terms of a sort of do you see that as a potential, I don't know, not a solution, but as a way that we could start to maybe sort of change sort of certain dialogues, is to sort of start tapping into people who've been there, been on the front line, work more with the kind of younger people coming through in a sort of a mentorship way, because I feel personally that there's a real lack of respect shown to people with wisdom and experience.
Yeah, it's an interesting question, and a good thought as well. But I suppose it depends what kind of arena you're talking about, because I mean, from I suppose my background and arena is quite narrow because I come from policing. So I think policing stands out as a little bit different from most professions in that, I mean, not everyone within police has come to the same conclusions as I have, and I am still in the minority. Although, having said that, wherever we at LEAP get the platform and opportunity to really engage with cops on these topics, we generally are able to bring people around to our way of thinking. So there's the wisdom, I suppose, that you're talking about. But unfortunately, it's not necessarily the institutions not wanting to appreciate the wisdom of the experienced people. It's just that, the institution of policing is it's a discipline organization, and it's very focused. And the problem you have is that it's not widely acknowledged that there is a difference between drug crime and other forms of criminality. People don't necessarily understand that. So I would say at least a third of cops, or around a third of police, are resistant to reforming drug policy because they don't want to lose the powers that they have that the Misuse of Drugs Act gives them. Most stop searches on the street are for drugs, but most stop searches, if they're not really after drugs, it's an excuse to stop what they perceive to be potentially a bad person. So, and I've even seen police on social media openly say, "Well, no, they're all bad people. This is a way of catching them." And it's a lack of understanding, a basic lack of understanding. And many cops just don't see any difference between someone who uses drugs and a burglar. They don't see any difference. It is merely someone who breaks the law, and they've made the decision to break the law. They don't see the difference, and that's a hardcore of policing thinking that we've got to erode away as much as possible. One way that we at Leap try and do that is by saying that if you arrest a burglar in a town of, say, 50,000 people, then burglaries will go down because there is an absolute finite number of people who are willing to commit that crime in that community and have the skills to do so. But if you arrest a drug dealer, crime goes up because you never reduce the size of the market. But because of the freelancer effect that police note through their intelligence all over the world, that opportunity that's created is often fought over, and that increases violence in the community. So that's one way of explaining to cops, but you have to have the platform and engagement in order to do so. And there's an institutional problem, and the way that police represents government policy, that's a real problem here, because and prevents the public being informed of the truth. And that is that there is a long-standing instruction. It's probably instruction number one from the Home Office to Chief Constables, is that they have to maintain public confidence. And so in seeking to maintain public confidence, there is no honesty of the efficacy of drug policy. And there's no admission of the extent of corruption which has been caused by drug policy within the police. Because from a Chief Constable's point of view, if they lose the confidence in the public, then the whole fabric of society breaks down and the relationship between police and the public breaks down. But the irony here is that relationship is breaking down because drug policy is destroying it. And if the public were better informed about the extent of corruption caused by that policy, then the social movement for change would grow and policy would change. So in essence, it's the institutional dishonesty from policing which is preventing the social movement growing more rapidly in the public. That's a rather complicated way of answering your question.
No, that's probably the best exposition of that argument from someone who actually knows exactly what they're talking about, having lived it, that I've ever heard. I'm not just saying that. In terms of Leap, so you mentioned Leap a couple of times. Do you want to maybe just go into a bit more about how long Leap's been operating, what it does, what its kind of positioning is, when did it start, that sort of stuff, bit of the background?
Yeah, Leap started in 2002 in America, and initially it was a protest group, and it was based on the famous early 1970s protest group called Veterans Against the War. And Veterans Against the War were very important because they were one of the most important groups which ended the Vietnam War, because when the public saw that the soldiers were coming back and protesting against it, well, if they're protesting against it, how can we support it? And I think most historians agree that they were significant in the ending of that war. So these 5 cops thought, great, well, if we can model ourselves on that, and make it clear to the public that, look, the soldiers in this war are downing their arms protesting, then we can make a difference. And I still believe now that thought process of soldiers putting down their weapons and calling for peace is the way that we will end the war on drugs. I think that our movement, policing movement, is the most important tool for international reform. So they grew. The United States is a huge country, and it takes time mostly for things to grow. And they grew and grew in terms of a speaker bureau, which is a bit like a sort of cell-like structure, training more people to spread the message. And eventually, in 2016, they grew significantly and became more much more professional. They shifted from protest group to major political advocacy group, and they did that by changing the name. The old name was Law Enforcement Against Prohibition. We were against prohibition. The new name is the Law Enforcement Action Partnership. Now, some of our older speakers hate the change, but it was very sensible because it's almost political activism 101, that you should never be against something. You have to be providing answers. You have to be with something or with someone. So we've made real advances in that change. In the UK, we started in around 2010 in a very loose way, mainly being held together by the brilliant Jason Reed, who does the podcast. But in 2016, we launched in Parliament under the new name. We had lots of politicians speaking, and we've grown and grown in support rapidly since then, really. And now we have good relationships with many political figures. We work closely with the Labour Reform Group, the Conservative Reform Group, lots of good SNP allies, Plaid Cymru, Alfon Jones, the Plaid Cymru PCC is a member of Leap UK. And we have, good allies in the Lib Dems as well. The Greens, we, together with JS Raffaeli, I contributed to their brilliant drug policy. So yeah, now we're busy, too busy sometimes to function in an efficient way, to be honest, because we're always reacting to what people want us to do, and sometimes that's at the detriment of things like internal comms and all of the kind of things that that makes an organisation work efficiently. So if anyone's listening to this wants to volunteer help, we always need help.
Right.
But our next stage is. Our next stage is expanding into Europe. So we already have Leap Germany. 2017, we launched Leap Scandinavia. We're about to launch Leap France. But through 2021, we're going to have a series of events where we launch the umbrella organization of Leap Europe. And that's going to be an umbrella organization so that, our speaker in Poland and Spain, they have something to belong to. But most importantly, having the Europe-wide organization, it's a bigger hook for journalists. It's a bigger hook for media, because we can legitimately and clearly say that the police movement for drug policy reform is rapidly growing across the world, and we're crossing back borders. We're crossing across international borders. I've met and spoken with cops all over the place. Cops from Africa. I've done events in South Africa. We have representatives in Australia who spend time teaching harm reduction to cops in Vietnam. Our movement is genuinely growing tangibly, often to the limitations or the relevance of a local nation or problems of a local nation. We may be decades away from being able to sell the idea of regulation to some cops, but at least we can sell the ideas of harm reduction and decriminalisation. So we're at different stages in different parts of the world, but as long as the movement keeps growing, as long as we keep working with our allies and getting support from our allies, we have this end of the drug war in sight, I would say.
So that's the end of part 2. Again, amazing interview. Please like, share, subscribe. You do all the things we need to do on social media, and join us for parts 3 and 4. Take care.